Hi, I'm Dr. Kobe Taylor with Fusion Pharmacy, and I'm excited to talk to you today a little bit about some things that are very passionate for me with around immunity. And just give you a little bit of background about me and how I got to where I'm at. So, I've been a pharmacist for over 20 years, and I have had a lot of experiences in Western medicine, in personal experiences where I was really sick. So, I had a lot of meds and a lot of things that weren't part of my life, part of me. I had high blood pressure and high cholesterol and anxiety and depression and a lot of stress, and I was on a lot of meds. And at the end of the day, a lot of the meds just weren't doing what I wanted them to. I still in a lot of those states, and ultimately didn't feel like they were making me feel better. If anything, we're adding more side effects. And I thought there has to be a different way. There's got to be a way to support our body. And we talk a little bit about lifestyle changes and nutrition in pharmacy school, but what I realized is that those things really matter. Is what we eat and what we put in our body really does have a huge effect on how you feel and your heart and your ability to be present and kind of how we deal with our day, and then actually giving the body the parts that it needs to heal. So when you look at it from a functional medicine perspective, so looking at root cause, what is disease? And disease often is a nutrient deficiency. And so as I've come to this realization, I'm really passionate about helping people really truly make meaningful lifestyle changes. Um, and that's really helped me change the way I practice as a pharmacist. So understanding that yes, medicine's an amazing thing, and medicine can come in and it can alter and change things and treat symptoms and help you bridge the gap until the person really truly makes the choice or buy-in to make lifestyle changes, meaningful lifestyle changes. And so I love doing compounding, so that helps us deliver medicines in a different way. I love to do traditional medicine because those are helping people understand the meds, what side effects they are, the nutrients they may or may not deplete, and the best way to make that drug as effective as possible. And some people are looking for other paths, so they're looking, how can I get off the medicine, how can I actually get well, and there really are solutions, and I like to be that hope for people that there really are other paths or paths to wellness by using different modalities. And I think as a group, as you bring together groups of people and practitioners in medicine in ways, how do we do that? And what works for one doesn't always work for another. And everybody's got that patient that is so hard to work with. And I love working with providers to help them maximize what their patient's experience is and helping them work through those things. So ultimately we developed Immune Packs. So we did this years ago, so long before COVID. And we put together ingredients in these things that really help boost the immune system. So it's got high dose vitamin D and C and elderberry and anthograpthus, and it's got some NAC, vitamin C. So the lots of your key things, vitamin A, lots of things that you need to boost the immune. And we're doing really high doses. So it's a 5-day pack. It's all lined out. So the packs are actually really easy to use. So they've got the pieces in them so you can see. You've got a kids pack, right? So there's gummies and they're a little lower doses. And then you've got the adult pack that's really high dose, that's really designed to kick the sick. So it's putting you into that space and giving your body what it needs so that it can actually fight off whatever infections and things like that it's casing. And we've had a lot of feedback. So we've sold over 3,000 packs. Lots of feedback from people that really do believe that it did shift and change their disease state and help them get over their sickness faster. And we blanketly use it for lots of different things, not just flus and colds and different bacterial infections and things like that. And we have had really good things. We do have a wholesale opportunity where you as a practitioner can buy it, so you can put it into we have a reduced price so you can make money off of it. We pack it for you, we can put your logo on it, and make it really easy for you to offer that to your patients. We're also really excited that we moved into some COVID packs. So Frontline Doctors has done they're doing research and articles and frontline things that talking to clinicians and what's really working out in practice and and really looking at, again, what's missing in the body, what would support the immune system, and then where's the research really going and those types of things. And so we put together a pack. So in this pack, we're just selling bottles. So we're selling a bottle of OrthoImmune. This has got vitamin C, D, zinc, NAC, and quercetin, and there's very good research on each one of those in supporting the immune and specifically helping with coronavirus. Then we're adding a little bit of extra C in there. It's our branded C to boost that a little further. There's good information on aspirin. It's not for everybody, but for some people this can be helpful, especially in long haulers or helping with disassociation of the virus and thinning the blood and helping with clumping and different things. But I've seen that being very useful in protocols. And then if somebody's struggling with sleep, there's added melatonin that you can add. Those ingredients are being used both in active disease to help support their higher doses in those cases, or in prophylaxis where people are using it to prevent and just have their immune system be in a state ready for and ready to fight if an infection does indeed come. And we have a lot of testimonials and people talking to us about that they really do feel like it's made a huge difference in how they work through those different things. So we're licensed in all 50 states. We're also working with practitioners to wholesale that and work with them to, if you're referring people or want to push people our way, then we're sharing in the growth of that and helping work with that. And if you're interested in that, please contact us. The ingredients really are key. So Frontline Doctors has done a lot of frontline research, right? And they're kind of on that cutting edge of looking at these different things and how and where the research lies. And so really good in actually showing that it's preventing hospitalizations and helping people get worse. And a lot of people will say there are alternatives to vaccine, but it's really, for me, it's like can go either way. So it's like whether you have it or you don't have it, people are still getting sick. And so it's really supporting the immune system to helping people get what they need so their immune system can actually work through those things. The prescription COVID pack is also an add-on where we have ivermectin being added in, and a lot of providers are using that. And so we've had a lot of positive results with that ingredient as well. So we're compounding that. We do that in weight-based dosing. Again, there is quite a bit of research on that, and if you're interested in those studies, we're happy to share those with you. We're also doing, there's an OTC product that I really like that I've come across called Artemic. It's got vitamin C, boswellia, curcumin, and an ingredient from wormwood that has some antiparasitic properties. It's over the counter, but I've seen a lot of people really flip and do really well with that product. So testimonial-wise, where people have taken it and the next day they're feeling completely better and fever and things are going away. So, and we have these wholesale things. So just if you're interested in helping a patient get an immune pack or a COVID pack, or you want to wholesale those with us or work with us and collaborate in any way, it's a great opportunity to kind of come in, get educated, get informed, and we're happy to share kind of our thoughts and our research and studies that we have. There's a link, so if you want to get in and have questions and want to get in contact with me directly or have a one-on-one with me, I'd love to go to lunch with you or whatever to discuss how to best support you and your patients and help you answer some of the questions that you get every day.